All right. Hello there. My name is Catherine Zhao. I am a master's in social work. I currently teach the parenting or lead the parenting works group for the Crow Wing County. Prior to that, I was a therapist for a short time, and prior to that, I was a medical assistant for 10 years before going back to school. So, healthcare background and mental health. So today I'm going to kind of focus more on what to do when you're feeling sick, and kind of things to do with like first aid in that. So first we'll start with like I said, feeling sick. So what does that look like? Kind of recognizing those symptoms of runny nose, body aches, fever, fatigue. And most importantly, if you are feeling down, like they say at work, stay home, or school also just stay home, rest up. You want to get at least 7 to 9 hours of sleep. Kind of important to recover, take those naps. When you're feeling tired, take a nap. Probably the most important thing is pushing those fluids. So it's important to stay hydrated. It helps with, if you're having a fever or vomiting, kind of helps keeping those fluids up, preventing dehydration. But it also helps with like keeping your mucous membranes lubricated, which that's what helps fight our infection. That's where our white blood cells, immune fighting cells, are located. So rule of thumb for knowing if you're hydrated or not, if your urine is anywhere from a very pale yellow to clear, that'll help you kind of see where you're at. Dark urines usually mean you're dehydrated and need to drink more fluid. You can also drink things like waters, teas, any clear broths or liquids. And then what should you eat when you're feeling down? Light meals. They're easier for your body to digest. So that we talked about this before, but the BRAT diet, so that's that bananas, rice, applesauce, and toast. Those are all foods that our body readily digests pretty quickly and easily for them. You kind of want to avoid those heavy, rich foods that are harder to digest, kind of helping your body rest so they can focus more on the healing process. If you have a fever, first things first, rule of thumb for a fever is actually 100.4 and up. Anything below that really isn't considered a fever by the medical community. So seek medical attention if it goes above 104. That is a sign that there's something really going wrong. But ways to lower that temperature would be like the cool, warm baths, light clothing, cool compress. Those are really good first line defense. And then Tylenol or ibuprofen if needed. And then make sure you follow directions on the bottle based on like your weight and that. If you have like the runny nose, like colds, the classic cold symptom, stuffy nose, congestion, best things are humidifiers in the room to help keep that moist air, again, keep that mucus flowing, really. Or you do hot, steamy showers. That'll help kind of loosen up that phlegm. If you have a cough, you kind of get that moving. And then honey is really good for sore throats. It's full of a lot of antimicrobial bacteria properties. Antibiotic, it can help with that. And then some lemon water is also really good for that. What happens if you have a stomach ache? So those classic stomach pains, nausea, vomiting, diarrhea. Again, very important to stay hydrated. Dehydration is not, it's not when a body's at a good state. And then if you can't keep fluids down, kind of do that small sips of water, ice chips. And if you're unable to drink, also you could try sipping on like some Gatorade or electrolyte drinks. Again, going back to that BRAT diet, easier to digest foods. Focus more during these times on hydration versus food. Your body can go longer without food than it can with fluid. So kind of focusing on prioritizing fluids and then think about food. And also avoid dairy and caffeine because those are harder for the body to digest. And caffeine can, it has the feedback that it does is kicks your kidneys in to cause you to urinate more. So then at that point, then you're losing fluid. So it's just easier to avoid that. And then just kind of stay positive. Yeah, no one likes being sick, right? Like it sucks, but it will pass, as they say. The too shall pass. So meditations, yogas, reading, deep breathing, and music, and just kind of unwinding to help yourself recover. And what's the best line of defense for preventing getting sick? Obviously, washing our hands. So that's really important to continue to do that. It's the number one way to help prevent spreading disease. So the length of washing your hands appropriate is to sing happy birthday twice. And then you want to really make sure you get between your fingers and kind of around your hands because that's where that's where the diseases and the bugs kind of live, is between your fingers really. And if symptoms aren't improving in a few days, then I would go in and see a doctor, or even just call the nurse call center. You can call that non-emergent line and see what they have for advice too, and what they suggest coming in. So now we're going to talk about some just like basic first aid, kind of some good basic knowledge for everyone to have. So the first would be that first aid can help save lives and prevent further injury. And again, what's the best thing we should do first is making sure that scene's safe, right? So if we can't help someone else, if we're going to get injured in the process, that kind of defeats the purpose. So check if the scene's safe, and then the next thing would be to make sure the person's okay, or if they are responding. So kind of that tap on the shoulder, like, hey, you okay? And seeing if they're responding. And then, and look and see if they're breathing. If you see any breathing, then and that kind of determines where we would go from there. So if they're not breathing and they're not responding, we want to go into CPR. And there's kind of a quick 4-step process to kind of think about with that. So first, call for help. Because before we start anything, we want to try to get help here to help, because we're just doing the preventative, or like the basic stuff to help save their life before the professionals come in to help. So call for help, and then after that, so you want to begin those chest compressions. So you want to look for the sternum, so right here with the breastbone, and then 2 hands down and push down. And you want to press hard enough to hear the ribs crack. Sounds terrible, but you're not doing it deep enough if you don't hear that crack. And again, 30 compressions to 2 breaths, so that we recommend like Staying Alive, that song. So that beat is really what the compression rate should be. So kind of getting that in your head. And then after the 30, you want to do 2 breaths. So you want to pinch their nose and tilt their chin back and breathe into their mouth. And you want to watch for the chest to rise, not the stomach, because you can see kind of a difference. If the stomach goes up, then you're getting air into their stomach, and that will cause them to vomit. That's not getting into the lungs where you want it to go. So like I said, pinch nose, tilt chin back, and then breathe. And tilting the chin back helps open that airway to get it into the lungs instead of the stomach. And continue until help arrives or someone comes with an AED. So just kind of keep going until, like I said, someone shows up, whether it's the emergency vehicles, another person you call that's coming to help the scene. And then from there, they'll kind of take over the scene at that point. And then next would be like bleeding. So what happens if like you cut yourself or you're around someone who gets injured and cut? So if it's just small cuts or scrapes, just wash with warm soap water. Bandage, you can use some antibiotic ointment if you'd like. Make sure that it's clean and dry area. Kind of the basic things that we've always done. If it's a larger cut, so a little different, first you want to assess to see how deep it is, and then first things first is try to stop that bleeding. So putting pressure on it, hard pressure, or making a tourniquet, so whether you use like a rubber band or you cut some of your shirt and tie it, just tie it tight enough that there's no bleeding. So kind of, your hand will look like, if it was your hand, like it's going to be purple, right? Like, because you're stopping that. And then if it doesn't stop and you're still struggling, then you need to call for help immediately. And even if you do get it to stop and you can see that's pretty deep, you want to go in because maybe you need stitches or further evaluation at that point. And then with those open wounds, when they're healing, kind of pay attention to make sure that there isn't any signs of infection. So that would be like the redness and pain to the area, any drainage or pus, and then swelling. Like really hot red swelling. Some swelling is normal because that's healing again, right? That's the antibodies coming and the white blood cells doing their job. But if it's really hot to touch or painful, that is concerning. So that would you want to be looked at. And then next, choking. So, so you come across someone who's choking or you have someone who starts choking, you want to kind of go into that Heimlich. So what is that? That's again where you stand, you want to find the breastbone, the base of the ribs here, and kind of make a fist and kind of dig it into that area and then thrust up, and that'll help push the body to force that object out. If it doesn't come out and they become unresponsive or stop breathing, you want to immediately lay them down, and that's where you want to go into chest compressions. At that point, what you would do is you would check before you would do breaths, because you would, so this is a little different. Before you would do breaths, you want to check, open up their mouth and see if you can see the object and kind of, again, hook sweep that out. Because if the object's impaled and you're trying to do breaths, it's not going to go. So then just continue compressions and then always check. And that's kind of what you would do. And then again, call for help if the object doesn't come out, right? Burns, so small burns, like think of like sunburn or like even just like a little burn on the stove or something like that. Just kind of treat the area with cool water, and then just do aloe or burn cream. Something else that actually is really good for burn healing is lavender oil and honey. Those are two things that have been proven to really help heal the burn much faster. Large burns, you don't want to use ice and all that, or cold water. And when I say, let me back up. When I say large burn, I'm thinking like 3rd-degree burn, right? Like you like really burned your arm. There's immediate blistering and redness, and like the skin is kind of coming off. Like that needs medical attention immediately. So no cold ice or hot water. Cover with a clean cloth. Clean damp cloth if you want so it doesn't stick, because it's going to probably be oozing, and then immediately go to the emergency department and kind of seek care on how to handle that. And they'll kind of take over from there. But again, those basic ones you can kind of just treat at home on your own. That's no big deal. What about a broken bone or sprain? That's not always a risk, especially with kids or if we're out doing things. So keep it still. You want to kind of like stabilize that area. And kind of if you're having trouble walking, you can like wrap it with a splint or go to like Walgreens or that, or get like a small splint to kind of stabilize that area, and kind of ice if it's swollen. If it looks broken or like displaced or like it just kind of looks off, go in right away. It never hurts just to go in and double check. That peace of mind is worth anything. And then kind of they'll go with their instruction. And even if like you fall and it is sprained and you are concerned and like you sprain your ankle and you're having trouble walking or pain, it's always okay to go in. They'll have other tips for you, whether that be exercises or stretches you can do to help with that. So when in doubt, just go in. It's okay. But basically, yeah, you want to just like ice, help with inflammation, and then rest. And then next is like what happens if you're worried about someone being poisoned. Call the poison hotline. That's your advice. We'll just go with that. They know what to do, and that's your best. Like that's what they're trained to do. So just call them, and they're gonna ask what they ingested, and then how much you thought it was, and then from there they'll give you advice on what to do. Don't induce vomiting on your own, because sometimes that could cause more harm than good. So just best bet, call the hotline, poison control. And so then, in this area, like what happens if someone gets too hot or too cold? So first, we want to get back to that normal homeostasis, that body temperature. So heat stroke, so we'll start with that one. When summer months gets really hot, someone gets overheated, they're red in the face, and just kind of like feeling kind of off. So you want to get them to a cool location and remove excess clothing. Cool baths, those are really good. Immediately try to cool the body down as quick as possible. And then like push those fluids again, get some electrolyte drinks, like I said, that Gatorade or Pedialyte or whatever it may be, and kind of help them cool down. If they do seem loopy though, or like they're kind of just off funny, saying funny things, not making any sense, you want to seek medical attention for that as well, because there might be more going on that medical professionals can help with. And then if they're too cold, hypothermia, right? That's a risk especially up in northern Minnesota. We definitely know that the winters get cold here. So you want to warm them up with warm blankets, warm drinks, kind of getting them back to that temperature. And kind of again, keeping, you could do like a warm bath or that, But ultimately, again, if they are showing those signs of loopiness, because that can also happen with being too cold, like the brain's kind of not functioning at its normal level, so they're kind of not making sense. Or you see like darkening of the skin, and you think like black darkening skin, feel like it's completely cold. Then again, you also want to seek medical attention for those things as well. Professionals have other ways to handle that. And again, rule of thumb, better safe than sorry. If you have any questions, any concerns, just go in. There's no fault in not knowing or asking for help. And that's more, if you feel embarrassed, a little embarrassment's better than to save a life, right? So that's ultimately what we're trying to do, is making sure everyone's okay. So, thank you.